Well, good day, everybody. This is Chris back again with the Ancient Scholar, and I'm going to continue talking about the toxicology of chemical weapons. This is the third video in the playlist, and what I'd like to do is I'd like to talk a little bit about the pulmonary implications of being exposed to chemical weapons or weaponized chemical agents. And so when we look at the pulmonary system in a very broad sense, we can divide the pulmonary system into two general regions, if you will. You have this region that consists of the upper airway, the trachea, the right and left mainstem bronchi, and then the bronchi then branch out into bronchioles, and you have this branching that occurs, and you have about 20, 23 different branches until you get to the terminal unit of the lung. The terminal unit's known as the alveoli. All right, there we go. And those divisions are known as generations. And so you have about 23 generations. 23 generations are a molecule to have 23 different little branches to get through before it got into the alveoli. Somewhere around branch 17 or so. All right, somewhere around branch 17 or so, the mechanics of gas flow changes rather dramatically. And what we have occurring in this upper region here, okay, down to about the 17th generation, is you have bulk flow. Okay, you have the bulk flow of air. Okay, so you have movement of air, and you have, of course, you have turbulent flow in the upper airways, and transitional flow, and eventually you get to more laminar flow patterns until you get to about the 17th division. And then from there down to the alveoli, you don't have this bulk flow mechanism occurring anymore, but rather you actually have individual particle diffusion. You have gas diffusion occurring. All right. So the mechanics of gas flow in a big picture change dramatically. And so what we do is, for the purpose of this particular video, I am going to name these regions and give these regions different names. The upper region, where you have bulk flow dominating, I'm going to call this the conducting. Okay, I'll call these the conducting airways. Some reading may call them upper or large airways, larger, the central compartment, whatever. I'm going to call these the conducting airways because you have this conduction, a bulk flow of air, and then down here I'll call these the diffusing airways. Okay, you have gas diffusion. Some people may call this a peripheral compartment, but I think conducting and diffusing makes sense to me. And the reason I want to talk about this is when we talk about the effects of chemical agents, understanding the area of the lungs that are effective really does make sense. And this'll kind of make sense as we go on further. So when we look at exposure to some sort of gas or vapor or particle, what are some of the things that really determine where a particle goes and where it interacts? Because that's really, at the end of the day, that's really when we have when I'm exposed to an agent with a pulmonary toxicity, really it just depends on where that agent is deposited in the lungs. So when we talk about deposition mechanisms, what are some of the major things we need to be aware of? Well, the first thing is the size of what other agent or particle, the surface. Okay, it's the surface involved, and airflow. Okay, airflow is going to play a big role, and then just the actual speed of the carrier gas moving in and out. So as a general rule of thumb, okay, your larger particles, we're talking anywhere from maybe 5 to greater than 30 micrometers. The larger particles are going to impact and affect the conducting airways. All right. And then you have these particles, maybe I'll call these the intermediate. All right, the intermediate. And you're looking at maybe 1 to 5 microns or micrometers. These are going to be really good at getting into the lower end of the conducting and into the diffusing airways as well. All right, and then particles, and I'll maybe just say small, particles that are less than 0.1 micrometers. These are going to be interesting in that these may pass right through membranes, and they may pass into the bloodstream quite easily, or they may be inhaled or exhaled without ever impacting or interacting with the airway at all. So clearly size plays a really big role. However, once you get to these really small sizes, less than about a micron, less than 0.1 microns, this size matters kind of mechanism really goes out of the window. And this is important because a lot of substances, when they're vaporized, nerve vapors and vaporized weaponized agents are going to be very small. We're not dealing with larger like particles of dust or soot. And we can't use this kind of simplistic, well, larger objects will tend to impact in the larger airways and smaller what we really have to do is we really have to look at this differently. And so I'm going to go up here, and we really have to look at the physiochemical properties of the particular agent. So what are some of the major factors? Well, water solubility is a huge factor. All right, water solubility is a huge factor. Highly water soluble or hydrophilic agents are going to deposit or impact, or whatever you want to say, that they're going to interact with the conducting airways. Because your conducting airways are right there, and they're lined with a lot of mucus, which has a lot of water, and there's a lot of moisture. So your hydrophilic substances tend to have tend to deposit mainly in the conducting airways, whereas our lipophilic, okay, so these are hydrophobic, so lipophilic. Okay, our lipophilic substances are going to deposit more in the diffusing into the diffusing compartment. Okay, the alveoli. In fact, they're going to be very good at passing through membranes. So that's one thing, and then just their individual reactivity. The actual reactivity of the molecule, the chemical reactivity. If their overall chemical reactivity is very high, so they're highly reactive, then they're going to tend to react rather quickly once they get into the airway. So you're going to see highly reactive substances, something like chlorine, for example. Maybe I'll just do this. Something like chlorine gas, it's pretty highly reactive, so you're going to have substantial conducting substantial conducting airway involvement, whereas your lower chemical reactivity agents aren't going to react right away, and they'll actually be able to make it into the diffusing, into the diffusing airways. And then of course the dose, when we talk about this, we're talking about the concentration that's absorbed. Your lower doses, your lower doses tend to sequester in a single compartment. So if a low dose of a highly reactive agent is going to primarily affect the conducting airways, whereas higher doses, in spite of water solubility and reactivity, the higher the dose, the more multi-compartmental the involvement becomes.